Okay. Hi, and welcome to my channel, Pink Aries. We have a special guest today. We have Dr. Gail McGill, PharmD, here to answer our questions and to have conversation about medications that we might be on or maybe we once took before. Again, these are just a couple of questions that hopefully will empower you to ask your doctor or to, again, just research and ask some questions, okay? And again, Dr. McGill, welcome. Thank you for joining us today.
Thank you so much, Tanisha, for inviting me to be a part of the Pink Aries. I would like to commend you on starting this platform. It's such an honor to be asked to be a part of it. And I pray and hope that it will be beneficial to your listeners. And as you said, I'm a pharmacist. I would like to start off by saying I'm not an oncologist pharmacist, but I have been a pharmacist for over 30 years. Part of my practice has been in the health maintenance organization, and I have worked for a specialty pharmacy where I have dispensed some of the medications that we'll be highlighting today. But I also like to say that what we'll be discussing today is by no means inclusive of all the information that's out there on these medications, but
Exactly.
we will be highlighting some of the points that I feel are beneficial if you may be on these medications or planning to be treated with some of these medications.
Mm-hmm.
And the medications that Tanisha had selected for me to highlight today are those that are used to treat the HR positive and HER negative for patients that may have metastatic breast cancer. And well, that is premenopausal. And the medications that she has asked me to highlight is the Kisquali, the Ibrance, the Zoladex, and the Tamoxifen. So we'll go ahead and get started. And the first medication we'll highlight today is the Kisquali. And like I said, the Kisquali is a wonderful medication that has been used successfully in providing treatment for various cancers. But some of the important things to look out for if you are treated with the Kisquali are lung problems. Lung problems can be very severe. So while you're on this medication, if you do notice any shortness of breath, coughing, wheezing, any chest pain, you want to bring that to your doctor's attention.
Okay.
Some patients, even though it's pretty rare, some of the patients have noticed severe lung problems. Another issue with the Kisquali has been the severe skin reactions. And with some of the skin reactions, it could be characterized by just a really bad rash that's unexplained. You're not sure if you have blistering, you don't have a sunburn or anything of that nature. It could be from the medication. So any redness, blistering, want to bring those type of symptoms to your provider. And if you notice any of these side effects, and you should feel free to chime in as I'm going over these. The next one would be the heart rhythm problem. And some patients have noticed irregularity in their heartbeat. So definitely if you notice your heart feel like it's kind of jumping or skipping a beat, any sign of feeling dizziness, fainting issues, it could be contributed to the heart. So want to bring that to your doctor's attention.
Now that one in particular is what I experienced when I was on this medication. And the reason why I asked you to go over these ones is because these were the ones that I was taking when I first got diagnosed. And the heart rhythm problem was something that I would be laying there and then all of a sudden my heart would just start beating harder and a little quicker to where they, when I brought it to my doctor's attention, they did do an EKG on me to try to see if I was having any type of concerns or issues that they need to further look into. Thankfully, everything came back negative, but I was experiencing that just sitting there. And then I was like, okay, wait, this not should be shouldn't be happening. As far as skin, I
Mhm.
did notice that my skin changed. The texture changed on my skin by taking this medication. And I didn't know if that was just me or if that was supposed to happen, but I would get little breakouts on my arm.
Yes, that could be part of, yeah, one of the side effects. Just don't want to get too severe to the
Mhm.
extent, yes, or cause that blistering and open up. It could be a source of infection. But
Hmm.
I'm glad that yours didn't progress to
Yeah.
that, those skin reactions. And what about the heart rhythm? Did it subside after a while, or did you just notice it occasionally
I
during?
noticed it occasionally,
Oh,
and it wasn't frequent, but it would be like maybe I notice it 1 month, a couple of months might go by, maybe 2 months would go by, and it would happen again, to where I would bring it to my doctor's attention again. I actually started keeping like a little journal, a log of when it would happen, just to make sure I
yeah.
remember, because so many other things I'd be thinking about, and I wanted to make sure I brought this to their attention.
Yes, and that is so very important. I like that you did mention that you kept that log, and I like to
Mhm.
stress for others too the importance of journaling and keeping a log and of any of those type of abnormalities, things that are out of the normal that are occurring. That's very important to bring to your provider's attention and have that the time, the severity, the frequency of it.
Mhm.
That is so very important. And another side effect with the Kisquali for some patients have been the liver problems. With the liver, what you want to look out for is any yellowing of the whites of the eyes or the palm of the hands. If you notice any yellowing, tinting,
Mhm.
that area as well as the bottom of the feet. When
Mhm.
that yellowing occurs, it could indicate there's an increased amount of bilirubin, which is a byproduct. And when your liver isn't functioning well, that bilirubin can build up and cause that yellowing of the white of the eyes, as well as the palm of the hands or palm of the bottom of the
Wow.
feet. That,
Wow.
as well as a darker color, like a tea color urine. So those are things to watch out for. There, those symptoms, yeah, could be from a liver problem. So while you're on
Mm.
the medication, you want to watch out for those as well.
I know for me, my um, the importance my doctor kept pushing was for me to be mindful of that. Is this something that can also be affected by me drinking a lot of water? Or is this no? Is that totally different?
Right. No, I
Okay.
haven't seen where that will kind of work
To
that affect
flush it.
the liver.
Okay. Gotcha. That's good to know.
Good question, though. And the next medication or highlight is the Ibrance. With the Ibrance, what I find to be very important with this medication, it's one that I have dispensed at the specialty pharmacy, and we have to be really mindful of drug interactions. A
Mhm.
lot of times with the chemotherapeutic medications, some insurance companies require that these medications be filled at a specialty pharmacy. So it's very important for patients to let each pharmacy know which medications they're currently taking. Because you may have a group of medications that's at Walgreens or CVS, and then you get another medication filled at a specialty pharmacy, certain medications. So it's very important for each of the pharmacies as well as your providers to know a list of all your medications that you're taking so that they could screen those medications for drug interactions. But some of the more severe drug interactions with the Ibrance are medications such as rifampin, and rifampin is used for tuberculosis. It can be used for various skin infections as well. Another medication, carbamazepine, which is used a lot for seizure control. Some antifungal medications, antibiotics. One in particular is Biaxin, and as well as certain HIV drugs. So again, the HIV drugs may be filled at a specialty pharmacy also. So it's important to let the provider know, as well as your pharmacies know, all the medications that you're taking. And these are prescription medications. Also, non-prescription medications, a lot of times patients forget to tell the providers or the pharmacy that they're taking herbal preparations. One that has been studied a lot is the St. John's wort, and it can interact with the Ibrance. So we want to avoid taking that with the Ibrance. A lot of times the pharmacy may not have this on your record because it's not a prescription item. So the St. John's wort, which some patients will use as a mood elevator, sometimes they'll use it for depression, but it's pretty commonly used, and it want to avoid that with the Ibrance, as well as grapefruit, pomegranate, as well as the juices of the grapefruit or pomegranate.
Now, oh, I'm sorry. I apologize. Go ahead.
Oh, no worry. Well, these, the grapefruit and the pomegranate has been shown to decrease the liver metabolism, which allows that Ibrance to build up and in the body. So it's kind of like you're having a higher dose of the Ibrance when you take it.
Again, this particular medication, I only took this for a short period of time before my doctors or my oncologist decided that we would go for a new, more aggressive route. But I like the fact that you just brought to my attention as to why I had to go to a specialty CVS to get this medication, and you know, the transport was different than my other medications I was getting from my local CVS store. This one came from a different one, and it was a different process. So I like how you know, because I didn't know what was going on as to why the change was. And I like the information that you gave about the grapefruit. I didn't really know why I couldn't have grapefruit. They just told me don't eat it, don't drink it, or anything like that. They just didn't explain, nor did I think I really asked in detail, but I like how you said it'll increase the dosage. That
Yes, absolutely. Awesome.
And I also want to say that the information you just gave about needing to write it down, I think if I was taking this medication again, just knowing that they don't have the information that my doctor has about what I'm taking is very important, that, you know, we write down everything and all the prescription and dosage. So
good. Yes, prescription, the non-prescription over the counter, herbals, exactly.
Okay.
Very good. All right, and still on the Ibrance, and just some of the less common but severe side effects, such as severe neutropenia, which is a very low blood cell count. A lot of times oncologists will be looking at your white blood cell count to make sure that it doesn't drop too low, but it drops, you know, significantly low. Your body has a hard time fighting off various infections. So that's something that they'll be looking at, and that's a side effect of this medication, as well as with a lot of the other chemotherapeutic agents. Again, severe lung inflammation, that's when you want to watch out for unexplained shortness of breath, cough, chest pain, and blood clots also. And these a lot of times may start off in the leg and migrate up into the lungs. So the blood clots, usually you could tell if you're having one if that area around your leg is warm to the touch, It's painful, so want to watch out for things like that. And then if it does get to the lungs, that's when you have very difficulty breathing, coughing, the pain. So want to watch out for blood clots as well, any of those type of symptoms.
Do you have
Again,
any?
these are they're less common, but they can be severe.
So for the blood clots, do you have something that you can suggest that we do to try to prevent that, or?
Good question. With blood clots in general, the recommendation is that you don't want to be too sedentary. You want to get up and kind of, walk around. If you happen to be flying, want to wear some type of support hose to help with the circulation.
Okay.
And even if you're on a flight, just try to do some leg exercise to get that blood moving.
Okay. Okay. Good to know.
Those are good. Yeah, good questions. Okay, and another medication we'll highlight is the Zoladex. And the Zoladex, something to watch out for would be bone pain. One thing about Zoladex is that it's used to decrease the amount of estrogen in your body, but when you first start taking it, it's not uncommon for that estrogen to increase for a while. So as a result of that, you may get, I'm sorry, a little ahead of myself here. With that, you may get some of the pain that you may have been experiencing in the past that may come back, maybe a little bit stronger than what you were accustomed to, but that's usually short-lived. Sometimes stopping of the menstruation, again, with your altering your hormones, is not uncommon for your period to stop.
Okay.
Injection site injury. This one is a pellet. So around that area where it's injected, if you notice any, pain, any warm feeling in that area, it could be a lot of redness, a lot of pain. It could be an injury site. So I want to bring that to the doctor's attention.
Okay.
And just with that site where it is injected, I have seen some patients to help with the pain. It may be a little uncomfortable when that pellet is injected. I haven't heard of being too painful, but some patients find that a little bit of Emla cream. And the Emla is a mixture of prilocaine, lidocaine, and just helps numb that area. And some patients will apply it to that site where that pellet will be injecting for about 15, 30 minutes. Sometimes they'll put just that cream there, maybe put a bandage on top so it'll get absorbed in, and that bandage could act as an inclusive dressing. Sometimes that Emla cream can be helpful in that area where the pellet is injected. As well, another side effect could be hot flashes, because again, your hormones, your estrogen is declining. So that's where you feel, just all of a sudden out of nowhere, you feel really hot and you start to sweat. That's sweating is your body's way of trying to cool down the body. But some patients will notice those hot flashes as well. Yes.
Hot flashes to the 10th power, I swear. These hot flashes that I experienced, they will come fast and furious during the day, at nighttime. You talk about a fight with the pillow and the sheets going back and forth, just being hot. Now, I did also experience the pain for these pellet shots, and I'm gonna use this Emma cream to numb the site, but I also use an ice pack. Ask for an ice pack to kind of help beforehand, before they would give me the shot to also, but I'm gonna definitely use the Emma cream because that is a big pellet that they inject in. So thank you for that suggestion. Definitely, I
Thank
will
you for
use
adding
that.
the about the ice pack also.
Yes.
In case the amla cream is not accessible, that ice pack is another alternative to help kind of numb the area.
Mm-hmm.
Awesome. Thank you. Okay, and we have tamoxifen. Highlight some points on that tamoxifen. Tamoxifen have some warnings. Uterine malignancy, any growths on the uterine could be of concern with the tamoxifen. Stroke, as well as the pulmonary embolism. The pulmonary embolism, again, is a blood clot that gets to the lungs. So with the uterine malignancy, if you notice any abnormal bleeding, you know, want to bring that to your doctor's attentions. That could be an indicator that there's some growth on the uterine that needs to be addressed. Stroke, again, you know, with the stroke, have difficulty speaking, or especially on one side where you notice your strength has weakened, eye drooping, one side of the face drooping, any of those symptoms of a stroke, you want to be mindful of that. Again, and the pulmonary embolism, if you notice any shortness of breath, chest pain, that could be some signs of a lung blood clot. Again, some of the common side effects, amenorrhea, which is the stopping of the menstrual cycle, fluid retention, which can sometimes be in the hands, swelling of the hands or the ankles, hot flashes, nausea, the vaginal discharge, anything that's not normal or a offensive smell, want to bring to the doctor's attention. The vaginal hemorrhaging, you know, significant weight loss, and skin changes. Any of those could be side effects. Again, if they become, you know, severe, just any of that vaginal hemorrhaging, that the blood, want to bring it to the doctor's attention. Anything that's not normal for you. Again, with the tamoxifen, you want to avoid the grapefruit as well as the grapefruit juice. And it could go with the pomegranate. I don't know if there's been that many studies on the pomegranate, but just to err on the side of caution, I would avoid the pomegranate as well with the tamoxifen.
Okay. Is it the citric, or is it what is in it that makes it something I should avoid?
The grapefruit?
Mm-hmm.
Oh yeah, just the whole grapefruit, just the grapefruit itself, where all the oranges, lemons, limes, they're all okay. They don't have the particular chemical in there, and it inhibits the liver, metabolism of the liver. But all the other citrus fruits, that's a good question. I get that a lot. It's like, okay, if I have orange juice, what about lemons?
Exactly.
They're all citrus, exactly.
Exactly. That's what I was kind of wondering, like, okay, am I doing anything wrong by eating fruits or something like that, other fruits? So I know now, based off of your information you gave, why I was having so much water retention. So for me, when I was on this medication, my hands would be so swollen to the point where, you know, it was, you could literally see it was swollen. And my fingerprints, I was losing my fingerprints. When I looked at it, I could not see the lines on my hands, on my fingertips. And it was so frustrating because I would go to swipe my phone. It wouldn't recognize it or something like that. But now I know what was doing that to me. I also would say, as far as skin changes, my skin became really soft in some areas. My legs became soft. I also noticed like my skin on my face had changed a little bit, the texture, when I was on this medication also.
Yeah,
So I didn't know where it was coming from until now that I could see, okay, skin changes was a side effect.
absolutely. With all
Yeah.
the hormonal changes the
Yeah.
body is adjusting to. Exactly. Good.
Now,
I'm glad that you can, yeah, elaborate on those firsthand your experiences. That is so good.
well, I will say I was on this medication for about a year. I was on the Kisquali, the Tamoxifen. I'm still on the Zoladex, but I was on it for a year. And I know, as far as being a African American woman, the certain things that was uh, very important was hair. You know, how did it affect my hair? How did it change my hair? I did not lose my hair in the sense where, you know, the doctor said you won't lose it within like a couple of weeks, but it did thin. I did notice a lot of thinning in my hair. I did notice that the texture changed of my hair
Mhm.
being on this medication. But that's the biggest thing. It didn't come out like some medications can make it do.
Right.
But I did notice thinning.
So good.
Yeah, so it wasn't like you comb it and you just have like balls of it, but it did get thinner as the year of treatment went on.
Oh, that's good to point out.
Hmm.
Because I know some of the chemotherapeutic medications can cause significant, yes, hair loss.
Yeah.
That's good to point out your experience with it too, because that is a huge concern for a lot of women.
Hmm. So,
And
and my audience is young African American women, so definitely I wanted to be able to share,
that's so good.
what to anticipate. So I this was very helpful for me too, to know this information. So thank you.
Good. Okay. And then you asked me also, you should tips for managing some of the side effects. So you had, diarrhea. I don't know if you've noticed diarrhea in any of your medications, but some patients do. So you want to make sure that you're well hydrated.
Mm.
Um, and if you need to have some of the electrolyte replacement drinks, like Gatorade, Body Armor is another one. I like the Body Armor because it does have more protein and less sugar. With the Gatorade, if you don't get the low sugar option, you want to watch the amount of sugar because Gatorade can be pretty high in sugar.
Okay.
But diarrhea, you do want to notice that, stay hydrated, decrease the amount of fiber also if you're experiencing that diarrhea. The nausea and vomiting, the recommendation is to eat, small meals. Sometimes that helps versus 3 larger meals. You split it
Mm.
up into five meals and little sips of water throughout the day. And just try to avoid eating if you feel nauseous. If you
Okay.
have to eat something, maybe like some saltine crackers. And they find that meditation helps also.
Hmm. Okay. Good to know.
Yes. And with these medications, it's not uncommon. You may feel more tired because your body is, in that fight mode. So it's using a lot of energy. So some patients do feel tired. So you do want to make sure you get plenty of rest. Try not to overexert yourself. Stay hydrated. And just try to get, if you can, small amounts of physical exercise, just in, little blocks of exercise if you can. And you want to avoid, alcoholic beverages, sometimes caffeinated beverages at night too can cause some insomnia. So watch out for, different iced teas or Cokes.
Okay.
And definitely coffee later in the evening, because that could affect your sleep pattern. And then like you had mentioned with the skin, with the texture changing, you could get, a rash. If you notice any of the rash, try not to take too hot of a shower. A little bit of cooler showers they find are beneficial for the rashes. And just want to keep the skin moisturized as well. And then infection prevention, which we all are trying to do, even if we're not on the drugs, these days with the social distancing, the hand washing, disinfecting, wearing masks, anything we could do to avoid infections. Because again, the white blood cell count may be lower. So it can increase your risk of infection. So just be mindful of that. And some doctors also, if they find out that one of the side effects is very bothersome, the dose may be held or the dose may be decreased in some cases. I think with you, Tanisha, you had your dose held at one point from the side effect of the neutropenia with the white blood cell count.
Correct.
Yes. And that was did they hold it for like a week or 2 weeks, or how did that work out?
They held it, and they maybe come back the next week, and so they could check it again to see if we could proceed with the treatment, because they didn't want to get into the danger, I guess, levels. So they wanted to kind of bring it up before we did it again. And when I was in that state where I guess I could be more susceptible to infection, I did have to worry about going around people. They told me don't eat at any salad bars or anything like that can risk, I guess, infection.
Right.
So yeah, that happened to me a couple times.
Oh, good. Oh, that's good to know. And then the cooling cap, which I've never, as a pharmacist, I hadn't seen it because we don't carry them, but I had seen where the cooling cap, like you had mentioned with the hair loss, Tanisha, that some patients had opt to that. Just have to look at the risk versus the benefits, the side effects, because it does add a lot of cooling to the scalp, which they find will constrict the blood vessels. So you're not getting as much medication to that area for certain medications if the side effect is a lot of hair loss. Some patients have found that to be beneficial, but that's something to discuss with the doctor. But definitely if you have cancer, in the scalp or in the hair area, you don't want to use that because you do want the medication in that area. But some patients have found that to be effective up to like 50% less loss with the hair.
Wow. I've heard of it, but I never knew exactly what it was, the cooling cap. So, it wasn't something that was discussed. So I thank you for now empowering us with this information to go and ask our doctor, okay, what about this? Is this something that I can do?
Yeah.
So I do appreciate that. But I wanted to talk about the side effect number 3, tiredness.
Yeah.
That was definitely something that plagued me, and it affected me even at work. So I was, multitasker. You could do all these things at one time, and I found myself now having to really just focus on one task, get it finished, focus on another task, get it finished, because I was tired, or mental fatigue, I guess is something you would say is a side effect. So I know it also was contributed because my sleep was also off, because I did find it hard to go to sleep, and it might be because I was fighting with the sheets and these hot flashes at night, to where you wake up and you're still tired. So I did truly experience that as a symptom with this treatment.
And going back to the hot flashes, Tanisha, did you ever have like a bottle of water, a cold glass of water or anything by your bed to drink? I'm on hormone replacement therapy now.
Okay.
So I don't experience the hot flashes, even though I am menopausal. But I did find that to be helpful somewhat. I don't know if that's worked for you.
You know, when they said they were sending my body into menopause, I had no clue what that necessarily meant. So what I had to do, I had to change my sheets. I had to go from lighter. I even went, I think, to bamboo sheets because they were supposed to be lighter. I changed what I slept in to something a lot lighter. I had one of those Yeti cups that could keep ice all night long. Yes. And I bought this portable fan off of Amazon that you actually could put ice water inside of it so it would blow at you, and I put it like right here.
Wow.
next to my face at night. These were just a few things that I found that I had to do
yes,
to kind of combat or deal with those side effects. I did bring it to my doctor's attention just how frequently I was getting them, and they told me to continue to monitor how frequently I was getting them, just in case there was something else they could do or prescribe me for it.
Wonderful. Yes.
Yeah,
That's
that's no joke. I don't wish that on anybody. Hot flashes.
Yes. Those are great tips, though, to share of how to manage.
So.
Good. All righty. And also, Tisha, you were telling me to come up with some questions to ask the oncologist. So what I thought would be good questions would be which side effects has she or he found to be most common in their patient population while on this treatment regimen. You know, when you get your information from the pharmacy, it'll list a lot of side effects warnings. But your provider, a lot of times they do specialize in just a certain small amount of medications. So I thought it would be helpful to get their perspective of what they have noticed in their patient population, what type of side effects that their patients have experienced. And did those side effects, did they occur immediately, or did they occur over time, after a week, a month, or some months? That way it kind of give you a good idea to find out, you know, what type of things to look out for, and how were the side effects managed. You know, did they use some of the things that we had suggested, or did the oncologist find that other things were helpful as well? So those are.
Okay.
Yes.
Now, I do like the fact that, yes, they give you a list of all the different side effects that you can experience, but sometimes I felt like they weren't giving it for a person in their 30s, how exactly this can affect me and my activity level, or you know, what things do I need to be concerned about as you know, a younger person. Again, like I said, explaining hot flashes to someone in their 30s, it didn't resonate until I actually went through it. You know, so I think that's a very good point to make. What has it, or how has it affected this population, this group, and how I should be concerned?
And as far as, your energy level also for certain patients, you know, do they expect you to return to work immediately? The patients that have been on this regimen, What
Mm-hmm.
was their situation like? Were they able to tolerate it well, or did they need to take some weeks off? And like you said, in your age group, what have they noticed? That way, it kind of give you an idea of what to expect as well.
Okay. Yeah.
But yes, so that was some of the highlights that I had to share. I hope it was helpful and beneficial,
Definitely.
and I pray that all the ladies that are going through the treatment, you know, go through it successfully. And it's just encouraging to know that there are so many newer medications out there that are improving months and years. I know when I was in pharmacy school, I think the only one was Tamoxifen. But each
Really?
year there's like all these new medications that have higher success rates, and that is so encouraging. But I applaud you, Tanisha, for having the blog and sharing the information.
Yes, and I love this idea that you wanted to come on here to share this information with, my community, with us, and to know that medicine is coming a long way. It's definitely, that sounds very good to me, knowing that eventually something will be done
Yeah,
to to hopefully solve this.
right,
But
exactly.
I want to thank you. I got notes over here. So, I mean, you took us to school, you gave us all this information, and I truly thank you, and thank you for being a blessing, and especially your profession, to everyone. So,
My
and please
pleasure.
come back again, and answer questions for us.
I would
So,
love to, absolutely.
well, thank you for joining us here at Pink Aries. If you liked the information that you heard, please stick around, subscribe, and we'll be giving you more information, more gems that you could utilize to empower you to ask questions to your doctor. All right? And thank you.